Hello everyone. In this video we'll be talking about lymphangioma. So what is lymphangioma? Lymphangioma is a benign hematomatous hyperplasia of lymphatic vessels with 3/4 of all the cases occurring in the head and the neck regions. So usually we see most of the lymphangiomas they are occurring in the head and the neck region areas. They are diagnosed as typically superficial lesions, but many a times we see they extend deep into the underlying connective tissues. Lymphangiomas they can be classified as simple lymphangioma, cavernous lymphangioma, cellular lymphangioma, diffuse systemic lymphangioma, and cystic hygroma. This classification was given by Watson and McCarthy. Now coming to the clinical features. The majority of the cases we see they are present at birth, but many a times we see tumor had arisen before the age of 10 years. So basically majority of the cases may we see they are present at birth, but many of the cases may we see they arise before the 10 years of the age. Here the male is to female ratio is equal, means it is equally distributed among the males and the females. The most common site of occurrence of lymphangioma in the head and the neck area is the lateral neck. When the lymphangiomas is occurring on the lateral neck, it is known as cystic hygroma. So in the picture we can see lympangioma which is occurred on the lateral part of the neck. Okay, we can see a swelling like things. So this lymphangioma which is occurring in the lateral neck is known as cystic hygroma. Now coming to the oral manifestations. The most common site where lympangioma occurs intraorally is the tongue. But other sites are also involved like palate, buccal mucosa, gingiva and lips. So lympangioma can occur either as a superficial lesion or as a deeper lesions. So when it occurs superficially, it appears as or it manifests as papillary lesions, which may be having the same color as that of the surrounding mucosa or of a slightly redder hue. So this is where we can differentiate a lymphangioma from a hemangioma. Lymphangioma they will appear as papillary lesions and having the same color as that of the surrounding mucosa. But hemangioma which is a vascular lesions will appear darker red or bluish red in color. But lymphangioma it will have the same color as that of the surrounding mucosa. So the deeper lesion they appear as diffuse nodular masses without any significant change in the surface color. So when lymphangioma is occurring on the tongue, we see considerable enlargement of the tongue, and this terminology is known as macroglossia, that is enlargement of the tongue. So in the photograph we can see unilateral enlargement of the tongue. So macroglossia it can occur unilaterally or bilaterally. So in the photograph what we can see unilateral enlargement of the tongue. Here in this photomicrograph we can see enlargement of the tongue. The lesions are papillary in nature and almost the same color as that of the surrounding mucosa. Sometimes we can see lip involvement and it is known as macrocelia. We have already talked about cystic hygroma, that is large, deep, diffuse swelling which is occurring in the neck. Now coming to the histopathology of lymphangioma. So it consists of multiple intervening lymph vessels in a loose fibrovascular stroma. So the most common histopathological type which we see is the cavernous type. In cavernous type of lymphangioma, we will see large dilated lymphatic vessels which are lined by a single layer of endothelial cells, and these endothelial cells, they can be flattened or having a plump nuclei, and the lymphatic vessels, they will contain lymph within it. So basically we will see the large dilated lymphatic vessels which are lined by nucleus, which can be flattened or plump, and the lymphatic vessels, they will have lymph within it. Those vessels just beneath the surface epithelium tend to fill or replace the connective tissue papillae, perhaps producing a papillary surface change. So in the photomicrograph we can see just underneath the epithelium large dilated lymphatic vessels. It seems that lymphatic vessels have replaced the underlying connective tissue and they are responsible for the papillary changes. So these large dilated vessels, what we can see, they are lined by a single layer of flattened or plump endothelial cells, and these lymphatic vessels, they have lymph present within it. So occasionally these lymphatic channels can have blood present within it, and if it is so, it will be known as lymphangioma. Means lymphatic vessels having blood within it can be called as a lymphangioma. Occasional lesions demonstrate proliferation of lymphatic channels within another connective tissue component, primarily smooth muscle cells. It is known as lymphangiomyoma. So, if smooth muscles are involved, we can say, you can call it as a lymphangiomyoma. So this is the histopathological types of lymphangioma. The first one is lymphangioma simplex. It is also known as capillary lymphangioma. So lymphangioma simplex mein what we will see? We will see small thin dilated lymphatics. Cavernous lymphangioma mein what we will see? Composed of dilated lymphatic vessels. Okay. So cavernous type में, as we have seen in the cavernous hemangioma, large dilated vessels. Similarly in the cavernous lymphangioma, what we will see? Large dilated lymphatic vessels. As we have seen in the photomicrograph, they will be present beneath the epithelium and they will be lined by flattened or a plump nuclei. Then comes cystic lymphangioma or cystic hygroma. It consists of huge macroscopic lymphatic spaces with surrounding fibrovascular tissue and smooth muscle. So cystic hygroma, what we will see? Large dilated lymphatic vessels and they are surrounded by a fibrovascular tissue or smooth muscles. Benign lymphangiendothelioma. Here lymphatic vessels appear to be dissecting through the dense collagenous bundles. So these are the four types of histopathological types of lymphangioma. First one, lymphangioma simplex, cavernous lymphangioma, cystic hygroma, and benign lymphangiendothelioma. Out of all this, cavernous lymphangioma we can see is present in the majority of the cases. So here in this photomicrograph we can see large dilated lymphatic vessels which is present just underneath the epithelium. It seems that these lymphatic vessels have replaced the connective tissue. Similarly, here we can see underneath the epithelium we can see somewhat smaller lymphatic vessels underneath the epithelium. We can also see the presence of blood vessels within the lymphatic vessels. Blood components within the lymphatic vessels. Here we can see large dilated lymphatic vessels present underneath the epithelium. So this is how lymphangioma will see under the microscope. Now coming to the treatment, surgical excision is probably the treatment of choice. So we have to remove lymphangioma surgically because lymphangioma is radio resistant and is insensitive to sclerosing agents. So if you have liked the video and if it is useful to you people, please subscribe my channel and like the video. Thank you.